Hello, everybody. Today we're going to be talking about part two in our series in parenting. But first, honey, let's do a podcast. Hello, everyone, and welcome back to Honey Likes to Do a Podcast. I am your host, Enrique, and this is my lovely wife,
Linda.
And today we're going to be talking about part two in our series on parenting. Now, to go back a little bit of what we did in part one, that was about our troubles getting pregnant and our infertility issues. So if you haven't taken a sound to that one, make sure to go listen to that one. It was pretty good, and I think it was going to be beneficial to a lot of people. Now, to go back on what we're going to be talking about today, today's subject is going to be on our postpartum depression, which is a subject that Linda really wanted to dive deep into. And also, our birth story, and, going back from when we went to the hospital, all that happened, and then obviously finishing with the postpartum depression part. Now, before we get started, do you need to say something, Linda, or do you just want to go right to it?
No, let's go ahead and start it.
Okay. So let's just start with a little bit of a backstory on the birth story. Okay, let's just give you a little bit of a background on that. Let's bring it back from the top. We're going to be talking about a couple days before or prior to going to the hospital. So for us, you know how you normally, when you have a due date and the doctor tells you this is going to be, your due date is X, Y, and Z. For us, it was April 21st of 2022. And, you're supposed to more or less around that time, you can basically go to the doctor at any moment, or you to the hospital. Your water broke, et cetera. You have to go in there, and it's
Waiting.
It's
moment.
time to. It's a waiting moment, but it can happen, and it's time to, to do the birth. Well, for us, we basically, and I think for Linda, she basically did not want to wait past that period, because you know how normally, if your due date comes and naturally you don't have any contractions or nothing's happening, or you're going to give birth, then you can just maybe go a week after that or a couple days afterward. And, you're very close, but you went past the due date and you might have to wait an extra week or an extra couple days or maybe even more than a week before you start getting contractions and, you got to go to it. Well, basically, Linda told the doctor that, if it gets to that point, then I prefer to be induced. And I just want to have the baby when it's at max the due date, right?
Yes, that's correct. And I think the biggest reason was because the baby keeps growing, and because of my age, I'm right at the borderline between what it will be considered a high risk pregnancy in the sense of age. And just to explain a little bit of what Enrique was saying is that when you get pregnant, the doctor give you a due date, but that doesn't necessarily mean that you are going to deliver that day. Naturally speaking, your body will tell you when your actual delivery will be, and that doesn't necessarily will match your due date. So that's what Enrique was mentioning. My concern was because I was in a high age. Well, not super high, but I was 34, 35, I think.
You were?
I think I was still
34.
34, yeah. Borderline with 35. At 35, you are considered a high-risk pregnancy. So I was right there at that limit. And I didn't want it to put more pressure because I know the more time, the bigger the baby gets. And when you are towards the end of the pregnancy, the baby grows faster. So the baby grows, larger amounts, not just a little bit. So I didn't want it to continue having a pregnancy if I didn't have to. And because of my situation, I was able to choose if I wanted to have my delivery at that specific due date. And that's exactly what I did. I request that to the doctor. It was okay. Insurance was okay with it. So everything was good. And that's why we were able to do it. So what happened was that we had to do some paperwork to make sure that all the documentation and paperwork was
Yes.
done, and to pay, of course, because it's a doctor.
So basically, what you have to do is that a couple days or the day prior or 2 days prior to your due date, you have to basically go to the hospital and they kind of do a blood work and they check you in. Basically, you're already pre-checking in so that when that happens, you're already, you already got your
Yeah.
room.
You just get there and they
Yeah.
take care of it.
Like you got a room assigned. You already know where you're going. You don't have to like then deal with all that as you're there or as you're getting there. So you're basically going a little bit ahead. And in our case, since it was induced, that means that the due date, April 21st, came and nothing happened, no contractions prior. So that means that the night of the 20th, which is the night before the due date, we basically checked into the hospital. We had our stuff. I think we might just go a little bit over what things you might want to bring. So maybe Linda can explain for the woman's part. I'm gonna say the guy's part. For us, it's not. You don't got to bring a lot of stuff. It's basically almost like you're staying in a hotel. So you're basically going to bring obviously clothes, pack up like maybe 1 or 2 days, maybe because you probably will go out at some point to get food and to buy stuff. So you will be maybe going in and out. Linda or the woman won't be really moving in and out of the hospital. She'll probably just have the robe that they give you in the hospital, and you'll probably be with that for a couple days until you have to leave. But you will be going in and out, and you will be, probably having to go get guests if they're coming to visit, and you got to go get food. You got to go to the cafeteria. You got to go this. You got to do that. You might have to go talk to nurses or to doctors. So you will need at least 2 or 3 sets of clothes, maybe depending on you want to shower a couple times or not, or what is your preference. Obviously, you would need snacks, so I would have snacks on the bag in case, when you guys are going through it, somebody gets hungry, you don't have to go out. Maybe, you're right in the thick of things, of contractions, and you don't want to really leave the side or go out of the room at that point. So if you have something to eat, it's better. Obviously, drinks, water, any other drinks if you want other type of drinks, but also, you depending on what you're doing, also check with your hospital if you're able to record, because I did check and basically they didn't want me to record anything of the birth. I could record prior to and afterwards, but they didn't want me to recording the doctor or the hospital. They didn't want me recording at the birth moment. Maybe you have lucky and your hospital lets you. So if that's the case and you check with your hospital and they do, you might want to bring if you have cameras and stuff, you want to bring that. If not, you can always use your phone. You can just record with your phone. But if even that, just bring obviously don't forget your charging cables. If you're going to bring entertainment, maybe you're going to bring a laptop, maybe you're going to bring, you're basically in charge of those things. Entertainment, snacks, I don't know. That sort of stuff. But that's basically the guy stuff. And then for the woman, I mean, Linda can kind of go through it.
Well, I actually have 2 sections. I have my section and I have the baby section. And the first and foremost, most important information that you need to bring is the documentation. You need to bring the birth plan, and you need to bring, I need to bring like license or stuff like that. So there's some documentation that your doctor will guide you, will tell you exactly what you need to bring. That for sure you need to bring that. That's the most important thing. And if I will say that, and the clothes that you will take the baby out of the hospital. Also, you need to have the car seat. You cannot take out the baby without the car seat.
Yes. So before you continue, in the part of the car seat, make sure that again, check with your hospital, because sometimes the hospital requires you to have a safety check of the car seat.
Yes.
Because ours didn't really ask me for it.
But they did request it.
But they requested, but they didn't ask me before the baby left. But some hospitals ask you to show them, like from a firefighter or a police station or whatever, like a safety check that your car seat is installed correctly, that it
Mm-hmm.
works perfectly,
Mm-hmm.
every yada yada, all that stuff. So make sure if your hospital requires it prior to leaving with the baby that you do it. Also, make sure you're familiarized with your car seat because sometimes they can actually a nurse can go with you with the baby and they want to check that you put them you place them right and you know how to put it in the car seat and et cetera, et cetera. So basically what we sometimes did is we had like a little teddy bear that was almost the size of a baby and we were using that to practice a couple times.
A few
It's
times,
pretty
just
easy. It's
two,
not it's
three
not
times
rocket
enough.
science. So you'll get it really fast, but just be familiarize it with it so that when you have to leave, you're not like, okay, so where does this thing go? Okay, where did we put the baby at? Okay, so you're not like that. You're a little more
Ahead of the game.
familiarized with everything. But again, remember, check to see if your hospital requires a safety check prior to leaving. Either way, I would suggest you guys do it just so you have peace of mind that the car seat's right is installed correctly. Even though a lot of times nowadays the modern car seats are so advanced that it's really dummy proof to do it. But still, I would probably just check because remember your newborn baby will be going in the car, and yet knock on wood, nothing happens. But if you do get, and let's say you have a bad luck and you get into an accident, you want to make sure that that's everything's safe there because you just got the newborn baby. But yeah, again, that's basically what you need to know in regards to the car seat.
Yeah. So we actually got ours inspected by fire department. So yeah, that was definitely checked. But I believe the police can also do an inspection, and they can also install it themselves. I think my Enrique installed ours.
Yeah, and then I installed it, and the police or
Checked.
the firefighters checked that it was correctly
Yes.
installed. I think you took it to check. To
Yeah,
get
I
checked.
did. I did.
Okay.
But if you don't know and you are not that craft or you're not well aware of how to install them,
Or maybe you
they
just don't
can-
feel comfortable. You just prefer, so you're 100% sure you prefer somebody else who
A
does this, a
professional.
professional or somebody who's having to safety check these things for them to install it.
Mm-hmm.
And maybe you just prefer to do that.
Yeah.
Because they're going to do it. If you go anywhere, any of those places, they'll do it for free. They just install it.
Yeah.
That's it.
So besides those things, which is the paperwork, the clothes that you are going to get out and the baby is going to get out of the hospital and the car seats, I don't think you really truly need anything else. Everything that is about the care of the baby and the care of the mom is going to be done in the hospital. However, there are a few things that you prefer to get them yourself. For example, I got like it's like a water brush or something that will help clean the area. The hospital provide one. It's not very good, so I wanted to have my own.
Is that the one that has the curve?
Yes, I don't. It's
Okay.
like a
Isn't
a
that-
shower, manual water shower.
Isn't
to
that
clean.
they had a name? The
Petty? I think it's like Petty something.
okay. But it's
Okay.
basically instead of using the little bottle that you throw water out, this one has like a little curve, so it's easier to apply.
I think it's called a Petty bottle.
Yeah.
And I mean, this information is a little bit old, so I need to refresh my mind.
And I would suggest you guys check. One thing that helped us with all this stuff is we started watching a bunch of videos and searching information about things you might need and objects you want to have at the birth, prior to birth, that things that would help you. A lot of it you end up not needing, but there's a couple things that are really
Helpful.
are really a knock in the park there. Like some of them are a home run. So
A
for example,
pillow.
that bottle was
The
good.
bottle was good. the diapers. There are diapers specifically for post delivery, and those can hold a lot of blood. And I'm telling you, once you have your delivery, you are the female, of course. It's going to bleed a lot for a full month. I'm not joking. A full month, you're going to be bleeding, and not a little bit. This is not the regular period. This is just like 10 times more. It's just a lot of blood, especially the first week. So you will need. This is a little bit graphic, but it's needed to be said. So you need kind of like huge diapers. I think mines are from Always. I don't have them with me anymore, but they were very helpful. What the hospital give you is a pad, very uncomfortable and chunky pad, and disposable panties. That's very inconvenient. In fact, the pad rolls and gets out of the way, and then you ended up ruining the sheets. So the diapers are way better. That I don't think you want to have clothes for the days that you are there, with the exception of
The day you have to leave.
the day that you have to leave, because everything will get ruined. You don't want to ruin your own clothes.
Well, but
use,
when you get there, they put you like in a little
hospital
hospital gown or whatever.
Yes.
Yeah. So it's
Yeah, just
while
stay
you're
with
there,
the
you're
hospital gown. I
using-
know
you're
it's not
using that.
pretty, but it will get messed up. So just stay with that in the meantime. And unfortunately, take pictures with that. I like to take care of myself, so I brought my makeup, and that definitely helped me. I washed my hair. My hair was clean. I was very clean. I want to make sure that I was as clean as possible before for that delivery, because I was not sure if I was going to be able to shower right away or how it will go. And I didn't shower like for the first 24 hours, I think. I had to wait a little bit to be able to get a shower.
well. Anyway, after we talked a little bit about what you guys need to bring, so basically, let's just give you a rundown of what happened. So we get there at the night of the 20th. They start giving Linda
Pitocin.
the pitocin, which is that that pill that starts making you have contractions, and the contractions is going to cause you to dilate. Is that how it's called?
Yeah.
And you start dilating until you get to, what's the number you have to get to?
10 centimeters
10 centimeters, and then you're basically at that point you're ready
to deliver.
to deliver.
And
I think those contractions start right. They start in a wide, like the time frame at the beginning. It's like between each contraction, there's a lot more time, and as you get closer and you start dilating more and more, the contractions are more frequent.
More
Am I
frequent
correct?
and more
And
intense.
obviously more intense.
Yes.
But am I correct? Right?
Yes. So it starts slow, and you don't feel as much pain. It's like a little something is going on there, and then it starts increasing slowly. And I'm telling you, this is slowly. It takes a lot of hours. I mean, I heard that some people get this done in 3 hours, but there's other people that get it done in like 30 hours. It's just,
Yeah.
it varies. In my case, was in the middle.
And you started it. They started giving you the pitocin. Was it on the 21st or was it at the night of the 20th?
I think it was at 9 p.m. on the 20th.
So that's when they started giving to you.
Yeah.
Because I remember you were able to sleep that night.
Yes. I was able to sleep, and they wanted me to sleep because they wanted me to
Rest prior to the.
Yeah, they wanted me
You're gonna have a hard day the next day.
have as much energy as possible for when the time actual come to push, because that's when the energy will go really, really, really fast. Because you are pushing, and when I'm saying pushing, this is just insane. There's no other pain in the world like that. I'm sorry, mans out there that you think everything is very hard for you. No, there's nothing like pushing a baby.
And especially in your case with we're going to talk about that in a second. But basically, so they started giving her that. the 21st, we get into 21st, then she starts feeling a little stronger contractions, things are starting to spike up. So then Linda decides that she wants to have an epidural. So the epidural is they inject in the spine, and it's to basically numb the area from waist down, I guess.
Yes.
So basically it's like basically you're not feeling, it's like kind of an anesthesia for that region, but you can still push and stuff. So it's not like they sleep, they just asleep, right? You still can push and you still can do stuff, but you just don't feel the pain. Or at least it diminishes the pain quite a bit. But this is one of the things that we had an issue with, that it wasn't as straightforward, because for Linda, when they did the epidural, it didn't actually properly work. So yes, it relieved her at the beginning a little bit, but then she started feeling pain again. So I think the doctor actually had to come in again and do a second round of an epidural.
Yeah. So what happened, and this is again something that varies from one person to the other, and was my case, and it's unfortunate, but it is what happened. So when they give you, they put you what's the name again?
Epidural.
The epidural. They put you that in the spine, in the back. You don't even feel it because you have enough pain already. So for me, it was nothing at all, even though it's a very large needle. So when they did that, the beginning I was fine, but they give you like a button, and you can press if you need to have more anesthesia.
Like because you right, I remember now. With the button, you basically inject more.
Yes. So if you need more because it's bothering you, you just press the button, and that should take care of the pain pretty much. But in my case, I keep pressing, and it was not going away. The pain keeps going, increasing. And I was like, oh, is this normal? Because obviously it's my first pregnancy. I don't know. But then the nurses around me, they were looking at me like, this is not normal. We should call somebody. And then eventually I got the anesthesia again. So the anesthesiologist
And the second time, it worked a little better.
It did work better.
Because you started feeling less.
Yes.
After the second time.
Yes. It did work better, but it didn't work like for other people. Like, I guess my body was not reacting accordingly how it typically works. I guess that's the proper terminology. So by the time that I got to 10 centimeters and it was time to push, oh man. I think by the time that you are 8 centimeters, you're already like almost screaming, get this baby out. And I think I mentioned that multiple times, get the baby out. I mentioned at some point, do the C-section, take it out. I was pretty much done at around 8 centimeters, 9 centimeters. It was just too much.
She was about to do the C-section. She's like,
I wanted the C-section at that point because the amount of pain was too much and I could not handle as much pain. But I don't even know how I did it, to be honest. But then you just push and push and push. And the way that they do it is that you have to hold to...
Yeah, but you push for like 10 seconds, was it, right?
Yeah.
So they count with you like
they count one, to second, and then push once you're
but they
10.
push, and then they start counting.
Yeah.
So they want you to keep pushing
2, 3
for like 10 seconds or something.
Yeah.
Then you take a you take like a couple deep breaths and then go again, push for 10. 1, 2, 3. And then again, it's like you do that like 2 or 3 times. And then you take a break. And then after the break, you go again and you do it 3 more times.
Yep.
But I think that's how it goes.
And
they usually wait because they're monitoring her. They monitor her in a monitor, and they have these things where they can see when the contraction is going to hit. So they usually wait for a big contraction, and that's when they want you to push, right? During the contraction.
Yes.
So they usually wait for, okay, it's coming, get ready, get ready. 1, 2, go. And then, and they're waiting for that contraction to kick in, and then boom, that's when they want you to push. Because usually those contractions last for like a minute, right?
Yes.
That's why they do the push for like 3 times or 10 seconds.
Yes.
Because they want to maximize that contraction moment. Then I think the next contraction usually happens 3 minutes after or something like that, 2 minutes after. So then you wait like 2 or 3 minutes until the other contraction hits.
And then you need to calm yourself and try to stay relaxed so you can concentrate in your breathing and then be able to push. Now, the problem with that is that it's 10 centimeters going out there. It is very hard to concentrate. You have so much pain that you cannot even think. And that's why Enrique maybe will talk about the actual delivery, because I don't remember much. Actually, the amount of pain was huge. I think I saw Enrique like going nuts or something.
I wasn't, but I didn't look. I was looking at you, but I wasn't looking at what's happening down there.
How was my face? Because
No,
obviously there was no
you were
mirror.
just completely worn out at the end. But so the baby got born, they placed her they clean her up, all that stuff. They put her in like a little table, and they wrapped her around. They put it in how do you call it?
The swaddle?
A swaddle, and then they gave it to you. But at that moment, you were so worn out. I don't even think you realized you had the baby.
I really don't remember much. I was very.
And then they put
exhausted.
her next to. I think they. I don't know if they clean her again. No, right. They just clean her up there, and then they swaddle. They bring it to you. At that point, you were like dead, so you weren't really. I don't think you were even paying attention to what was going on. And then I think they put her. They got to measure. They got to measure her. They got to weight her. I think they run some small tests quickly.
Mm-hmm.
They take like some, I don't know if it's right there and there, but they do take some like blood from her, from like the toes or something. And then they just put her again. They put her in like a little incubator next to the.
But I saw you guys taking pictures with her.
Well, you can take pictures at that point, but we weren't picking her up and stuff. I was just taking pictures
Oh, okay.
of the moment. We did take more pictures after that night, the next day. That's when we were taking more pictures. But basically that night, was it that night that she stayed? Yeah, it's that night that she stayed in a different room.
Yes.
Because they had asked us if we wanted to sleep that night, and then she could stay in like a nursery or something. And then she would stay there, and then we would sleep, and then the next day they would bring her back. And I think that's what we did. But it was funny because nobody could actually sleep, because they said this to Linda. Oh, so yeah, we'll do this so you can, you have a little more sleep, and you have a little more energy for tomorrow since you had a tough day, yada, yada. And then every like hour, they would go by the room to check something.
Yeah.
We just want to make sure that you have your blood works right. Oh, we just want to make sure that your temperature is right. Oh, we got to check for oxygen, whatever it is. I don't know. They were like checking all the time.
I was having a huge problem with going to the bathroom. Do you remember? So
they had to do like a stick like a tube or something, so that you would pee straight into that.
Yeah, I couldn't. I was so swollen down there. It was pretty much destroyed down there that I could not pee. So yeah, they have to put I don't know,
Catheter or something.
Yeah.
It's like something where a tube where the pee just goes straight.
Yeah.
Into like a
I think it's
bowl
called a
or
catheter.
something.
Yeah, so they did that. It was supposed to be for 1 day, but I still couldn't go to the bathroom, so I had to do it for 2 days.
But that's one of the reasons that you had to stay an extra day.
Mm-hmm. Yeah.
Because they couldn't give you They couldn't give you discharge from the hospital because you couldn't go to the restroom.
You had to go to
You have to at least go to the restroom once.
No, 3 times.
Oh, 3 times. Okay.
Yeah. Yeah, that was the problem that I had after birth. And also, I didn't tear because my doctor actually did a small incision, and that was enough. Also, I did prepare for the delivery. I went to the gym since I knew I was pregnant all the way till the end. So I trained my body and did a lot of exercises to have enough strength in the lower pelvic area, or I think it's called the some ground floor or something like that. Pelvic floor, that's the name of it. So I want to make sure that I have enough strength. So, because I was horrified with the whole tear situation, and I trained to make that area as strong as possible, and that's why I did not tear. But I did had a small incision that my doctor did. I did have small little broken sections, but they were not considered tears. A few small, but inside when the baby was coming out, but nothing in the actual area that usually there is a tear. So that's also something that might be helpful. Just train your body, especially do exercises that are related to the pelvic floor, because that do help. And there are there are different kind of tears. There's tear 1, tear 2, 3, and 4. Number 4 is the worst, and 3 is also pretty bad. Number 1 and 2 are the best ones. Most cases is 2 or 3. So be aware of that information as well, because tears are not fun and you can get infected and stuff like that. So it's better to not have it in the first place.
And so to like finish and wrap this up about the birth story, when the baby was born, one of the things that did happen that we, it was a little bit of a inconvenience, but apparently it's pretty normal, or it's not that abnormal for this to happen in babies. Our baby was born with jaundice, or she didn't have a super amount of jaundice, but she did have jaundice apparently. And that's when you have a slight yellowish pigmentation or discoloration in the skin. So your skin looks a little more yellowish. And that's because you have an excess of bilirubin in your blood. And apparently, though, she did had this, to the doctors, or the nurses took her to this place where they did a phototherapy, and that's a treatment for that type of thing, which is there's a treatment with a special type of light, okay, and they expose the baby to this light, and it's to help reduce the levels. And I think they basically cover her eyes with a little wrap, because I went down there with her that night to see where they were taking her and stuff. And they put like a little parch on your eyes so it doesn't hit your eyes. And then they have you naked. They have the baby naked, just taking in that light. And they usually do this for like, at least ours was there for like the whole night. And they just expose you as much light as possible. And this basically, it makes it easier for the liver of the baby to break down and remove that bilirubin from the baby's blood. But that's about it. I mean, after that, the jaundice levels came back normal. And then, after that, it's just regular sunlight, or the regular just exposing to the sun will just also level things out. But sometimes that can happen, and it's not that abnormal. So if your baby does look a little more yellowish when she's born or he's born, then it probably has this. But don't be freaking out or whatever. It's normal. Like it's not like anything's wrong with it. It's just, like I said, an excess of bilirubin in the blood. And I think after that, I mean, basically, like Linda said, we had to take an extra day. We had to stay an extra day because of she couldn't really pee by herself. But after that, she kind of was able to pee 3 times. So they did discharge us. I think we stayed there 2 nights.
Mm-hmm.
On the 3rd day, we were discharged. And that's the day we had the car seat, we take the baby. That's when you really, when you're taking it home, a lot of people, that's when they want to, put some pretty clothes on the baby or whatever, because you're going to take some photos because you're getting discharged and you're going home with the baby. We had a set of clothes for the baby to leave the hospital. Linda had her clothes. And, but after that, we went to home. You take her home, and that's when the real fun starts, when you take her home. Because that's when you don't have no more, at the hospital, you had the nurses helping you. You had the doctors helping you. You got 24/7. They were checking you all the time. But now when you get home,
Things get
now
real.
when that baby starts crying,
No
you're like-
nurses.
and you're like, what the hell's going on?
How I'm gonna take care of this?
And nobody's going to be there to tell you, hey, it could be this, it could be that. And you're like, well, it doesn't stop crying. I'm tired. I want to sleep, but the baby doesn't stop crying. And then you're gonna be like, ooh, this ain't as simple as I thought,
No.
And then this is where the fun begins. But the good thing is you do get a lot as the time goes. You do get a lot easier at understanding and managing it, because you learn. You're learning all the time what the baby likes, what it doesn't like, signs that he gives you that it could be this or it could be that. You start understanding when it's hungry, when it's wants to poop, or when he's pooped, or when he peed, or when you had to change the diaper. Because you're getting the cues, and you're getting more familiarized with it. But at the beginning it's a whole, like, you just don't, you're like, what the hell's going
Upside
on?
down.
You're like, what's going on? And specifically when the babies doesn't sleep at the beginning. The babies don't sleep for a lot of time. They sleep all the day, but they wake up every 2 to 3 hours mostly. And then as soon as the baby wakes up, it's not that it wakes up and is there. No, it starts crying as soon as it wakes up. And the thing is that at that time, at the really early stages, newborn and all that, basically they wake up because they're hungry every 2 to 3 hours. That's what happens. So you just want to eat. They're eating constantly. So you have to feed him, right? It's every 2-3 hours you have to feed him.
Yeah.
If you're breastfeeding, basically you got to get up every 2 to 3 hours to give him the breast, give him breast milk. Or if you're not doing it straight up, you got to pump and then give him the breast milk pumping.
That's even worse.
And if not,
you're
then you just have to give the
double
formula and give him the formula every 2 to 3 hours. It is what it is. I mean, if you are doing breast milk and you're doing that, there's a whole sort of other challenges that could occur. Because, giving breast could be, for some people, it's really simple. For other people, it's a pain in the ass. So if you're one of the lucky ones that's really simple, then, hey, congrats, great. It's much better than giving the baby formula, that's for sure, because you're giving him your antibiotics and all that stuff. But it's only if it's simple. A lot of people have issues, and Linda was one of them, where it wasn't as straightforward to give them breast milk. And she still did it for a good amount of time, because, again, you want to try to give the best to the baby. But sometimes, like, I know that if she were to have a second one, she would not do it again. Like, straight up, she would just do formula from the start, because she doesn't want to go through that again. That's why you have to understand your body. To each their own decision. It's completely fine for, like, my mom, us, and my two sisters. We're three siblings. We're all formula. None of us got breast milk, and everybody's completely fine.
I think there was something that happened during that same time. There was a huge recall of formula. Do you remember that?
Oh yeah, from the what's that company?
Similac, I think it was.
Similac, yeah.
Yes, it was a huge one, and Similac is the biggest company about formula.
There was also a shortage A
There was
shortage of formula
it
too.
was a huge shortage, so it was a
But that's
complete
because
disaster.
because of that Similac thing. The problem is that they closed down the factories at that around that time. So they shut down some big Similac factories. So obviously, since that's one of the largest brands that does formula, well, you could guess there's a shortage of formula all of a sudden.
Yes.
So everybody's just buying formula left and right, and you couldn't like. I remember that they were like limiting the purchase to one or two per person, and and you barely were able to find one. So when you found one or two, you want to buy all two or three of them. But obviously, you're not the only one in that boat. So it's obviously understandable that they want to limit the amount so that everybody can get their fair share at
Yeah.
or fair chance at getting one.
And I do remember during that first week that we were home, my milk was not there yet, so I needed to give them formula after I do the breast milk because I was not producing enough. I was barely producing colostrum. And colostrum is very important for the babies because that they have huge amounts of vitamins and what's the word?
Antibodies.
Antibodies. And it helps a lot the baby. But I was not producing milk, so we had to give them formula. And what apparently happened was my baby was having a lot of diarrhea, and we couldn't understand why. And okay, we are first parents, so we thought that was normal. But then I have the in-laws here in the house, and she was like, "That doesn't seem normal." That the baby have a lot of diarrhea, and we were trying so hard for the baby not to get a diaper rash because it's the first week they are born. So it turned out that the formula that we were given to the baby was a recall formula. So it was a bad formula. So then after we finished with that formula, we make sure that the other formulas they were not recall, and that's how the diarrhea was gone. But it took us like a few days to figure that out. I mean, everything is new, and we were exhausted. I was exhausted. I think I still exhausted, and my baby's 17 months right now.
Nowadays everything's pretty much
Yeah,
back
that
to
was a
normal.
very specific situation, a very specific time. I think we got it in the hard way.
Yeah, and again, you just do what's more easy, what's more comfortable for you. If your baby's taking the breast milk fine, then you really don't really have to worry about a lot because you don't have to worry about buying formula. You're just producing milk. The problem is not only is if the baby is attached, is latching and all this stuff to the breast, and you don't have any issues there. It's not That's not the only problem. The only problem you might have is that you don't produce enough milk. So if you're like a really low producer, then you're gonna have to supplement that with formula. So you're gonna still need the formula regardless if you give them breast milk. So again, there's a lot of factors that go into this, but just do what you feel like it's better and like it's easier for you, for the baby, for everybody.
And also, you need to be aware. The breast milk is grease, like fat, has fat, and so everything is warm inside. But my particular case is I have small veins, so also the veins in my breast they are smaller than typical or thinner than typical, and I was getting a lot of clogs. So that was the main reason why it was so hard for me to do the breastfeed, even though I almost did it for 6 months. It was very, very painful. You can get infections because of it, and it can get really, really bad and really, really painful very, very fast. So that was for some females that doesn't happen, but honestly, most of them will go through some kind of infection when they are doing breastfeed, specifically first time moms, because we don't know. It's just a lot of misinformation, or we just don't know. And so that, just be aware that that might happen. The best way to get it out, to get the infection out, is to pump as much as possible, or put the baby to suck as much as possible, or have it as much as possible with you. That reduces the amount of infections. But sometimes I will get clogs even though I will pump and pump and pump, and I will just getting too many clogs. I will get 3 in one day. The next day I will get 2 more. It was just abnormal. And it was like that for a very long time. I remember one time I was showering because I had 3 clogs, and it was like 12 hours already, and the clogs were there and they were not going anywhere, and I had a lot of pain. And I was crying. I was desperately crying in the bathroom, in the shower, trying to open the clog. And he got in, and I think he was concerned. He was like, "Are you okay?" or something like that.
Yeah, and I think in that time, the easiest way to get a clog out of the way
Unclog, yeah.
is if your baby can suck the milk out, because your baby's suction is really strong. So any type of clog you have, she'll probably, get rid of the clog. So that would be the easiest. The problem that we had is that Victoria didn't really like to latch into the breast. She didn't really want to suck the breast. She liked the bottle.
Yeah.
So it was really hard for Linda because, we couldn't really use her, which is the easiest way and the most effective way not to have a clog is if you just have the baby take milk directly from the breast. Because if there's any type of clog, she'll just, suck it right off. And then again, you're just not getting clogs because you're constantly giving the milk.
And I think that might be my fault now that I'm thinking about it, because 1 week, 'cause she was sucking perfectly well since she was born. Do you remember that she had a latch perfectly well the very first time? So she was very good at the very beginning, but then later I decided that I wanted to pump instead of having her directly.
Yeah.
And maybe that was the reason that later on she didn't want it to latch anymore.
Yeah, because obviously when you pump, that means you're going to give him a bottle. So she just got used to the bottle
Yeah.
after that.
And the bottle is easier than sucking from the breast.
Yeah, way easier because the breast, she has to struggle way more to get milk.
Yes.
While there's in the bottle, she's like, oh, this is easy. She just grabs milk easy. So she just gets used to that. If she tries to give the breast and she's like, and nothing comes out, she's like, what the hell is this? So she's going to start crying. And she's like, give me the other stuff that it's easy. So, that's one of the pain and stuff you have to go through. But that's more or less, we want to talk about it. That's more or less the birth story. Because after this is just having her at home, and then you just get used to all the different things that change and all the things you got to get accustomed to as a new parent. But now, basically, I don't know, Linda, you wanted to talk about that second subject.
Yeah, this second subject, I'm gonna make it brief because I know we have talked a lot of things. So
we're talking now about, we're going to talk about postpartum, right?
Yes,
okay.
Postpartum depression.
So now, just continue.
Okay, so once you deliver, everything changes, especially for us. We have a lifestyle. Well, I think we still do have a comfortable lifestyle. But before we had the baby, everything was like, I had so much time available. I can, go and have a nice shower, relax, wash my hair. It was everything calm. My house was pristine clean all the time. Everything was like very, very, very nice. And I had all the time in the world. And I didn't realize I had so much time until now, until after I have the baby. So suddenly the baby come, and it's not a bad thing, but it's just a lot of changes in a very, very short time. It's like, boom, it hits your face. And then also on top of that, you're dealing with your body that is in very bad shape. You don't like what you see in the mirror. I didn't like what I see in the mirror, and I was concerned that my body was not going to go back to the original shape. I don't think it is in the original shape. I don't think I will ever go back to my original shape, especially the waist section. It gets wider. But I will look myself in the mirror and I will not feel comfortable. I did not feel comfortable inside either physically either, because I was in so much pain and I was trying to recover from the pregnancy. And I have suddenly a huge amount of stuff that I suddenly need to do. I need to feed the baby every 2 hours, and I need to pump, and I need to change diapers. And then all the people start giving me all of their advice, which is a lot of advice, and I am already overwhelmed and I'm already dealing with a lot of stuff. I'm sure those advice don't come with bad intention, but when someone is just to brought a baby to life, is just especially the female is going through a lot of things, and it's just very hard. And in our case was very helpful because Enrique's mom was here and she was able to help us, and so that was very, very helpful during the first month, because she was here for a month.
Yeah, my parents stayed here for a month at the beginning, the first month. Yeah.
Yeah. After that was when
Actually, I think it was a month and a half, but basically around a month.
something like that. But then after that, after she left, it was my husband was working and he will come late, almost nighttime. So it was just me for 2 more months, because I have almost 3 months of
the pregnancy leave, or the your baby's born.
Yeah.
Maternity leave.
Maternity leave.
Maternity
Yes.
leave.
So I was all day alone with the baby, taking care of the baby, and I was just very exhausted because I couldn't sleep during the day, I couldn't sleep during the night. So many stuff. My house was a mess. I didn't like my body. I barely see my husband, and then suddenly it's just a huge chaos. And I'm trying to enjoy the baby as much as possible, but I can't because I'm exhausted and I'm just very, very tired. And again, I keep receiving, because at the very beginning, you do receive way too much advice. And sometimes it's better to just stay quiet, to be honest, because it's just too much and it's very overwhelming. And that's exactly what happened to me. I was very overwhelmed with everything. And I felt alone. And even though, because it was just, at that point, was just Enrique and me. And he was working the whole time. He will leave very early in the morning, around 7 a.m. And he will come home 7 p.m., 8 p.m. sometimes almost 9. It was very late. So I was literally alone the whole time. It was just eating me. And then we had to go to these appointments with the doctor, the baby doctor. And she will give me a formulate questionnaire.
Yeah, you're saying it in Spanish.
Yeah, I'm sorry. So I have to fill out that form, and it's pretty much asking you from 1 to 5, how do you feel about, how happy do you feel doing this activity, or how happy do you feel doing this other activity? Just making simple questions. But then I started at the beginning happy faces, like number 1. And then I started number 2. And then I started number 3. And then some of them I started putting number 4, which is sad. You're sad. And the doctor called me and she was like, you actually have postpartum depression. And I broke down because I was scared that I might get postpartum depression. And it was because I was so overwhelmed. And there was a point that I didn't even see light. It was just, this is my life now. I'm stuck with this. I have no way out. And I have no one to rely on because my husband was working, which is me. And then I was like, how I'm going to work, how I'm going to do stuff. I didn't have options and I felt trapped. And that feeling of being trapped kind of like sucked my soul out. And then I didn't have emotions. I just was crying the whole time. Do you remember
Yeah.
that time?
Well, I mean, I remember you telling me about it. I didn't actually see you cry. I think I only saw you cry like once or twice, but most of the time it probably was during the day. Or
I
sometimes
will
when
cry
when I
pretty
was not
much
in the
every
house.
single day.
Yeah, but a lot of times it wasn't when I was in the house,
Yeah.
so I didn't get to see it that much. And I think also Linda didn't want to actually tell me
Yeah.
much that she's like having all these issues. I think she didn't really tell me that much about it. She mentioned it a couple times, but she was trying to keep it to herself.
Well, I think that's because I'm more introvert than Enrique. You are very extrovert, but I'm like a hybrid between an extrovert and an introvert. I'm not truly extrovert, but I'm not truly introvert either. It's like somewhere in the middle. So I kept a lot of stuff, especially if it's something negative. I try to keep it to myself for some reason. And but yeah, if I hear a song, I will cry. If
But I think for Linda it was also tougher because not only all that changes, right, and she's having to deal with all that, but also the whole thing that she was doing breastfeeding, and that's extra stuff you have to add to it. Oh, like all of a sudden, oh, now I got a clog, now I got this, and it hurts, and then after I got to take this pain out, but the baby needs attention at the same time. So you're like, okay, so what do I do? So she's not asleep, or I got to make her sleep, and then I got to deal with getting the clog out, and then this and that, and then it's just extra stuff that was happening, and I think the combination of everything didn't actually help her, so it actually made it worse, and I think it aggravated you even more, all the little nuances that were occurring. But just so you all know, there is a light at the end of the tunnel. Time goes by, and this is me. I'm telling you, as a coach, what I tell my students. Obviously, this is a completely different scenario. This is a way harder a lot of times, specifically for the woman or for the dad. If it's a single dad out there taking care of the baby, which is quite often as well, and that's actually another big pain because then you if you're alone, you're probably gonna have to work, take care of it, and do everything yourself. But so I know there's single dads out there who
and
single
single moms
parents
too.
and single moms too.
Actually,
But
single moms
let's
is
just
very common.
let's just make it. Well, yeah, that's a pretty common one. But let's just put it in an example of your typical mom, dad, both parents are there, which is our case, right? Household. In that situation, there is a light at the end of the tunnel because time goes by and that's your best friend. It looks hard. It looks like it's going to take, forever. You don't, like Linda says, you don't see a way out. But again, time goes by. And when time goes by, that means that you go through phases. You're going to go past these phases as well. So what it seems like an eternity will come and will go. So you have to concentrate. And this is what when Linda would break down and stuff, and I would always tell her, remember, it sucks right now, but the baby will grow. The baby will have a period when she's going to be sleeping more often. There'll be a period when She won't need you as much as it's needing you right this minute. You'll have a little extra time. It's not going to be as when you didn't have a baby, obviously, but you will have more time. And everything keeps going with time, because if you think about it, our baby now is almost a year and a half. We have more time now.
Yeah.
The baby does sleep the whole night. So once we put her to sleep, we don't have to worry her until like 7 a.m. Again, other people have more issue with the sleeping thing. We got lucky. Other people at a year and a half, they're still having issue with the baby sleeping. So again, this is all depending on what goes for you. But what is certain is that it doesn't matter if it takes you more or it takes you less. You will go through phases, and you will keep progressing, because maybe still at 3 years, you feel like you don't have a lot of time as you were when you were single and whatever. But remember, that baby's going to keep growing. And when they go to 10 and 11 and 12, 13, 14, all this, every time there's a different challenge, but you feel a little more relaxed in things that were bothering you before. So you have to concentrate, and then these are all steps and periods that you're going to have to go through. And even when you're about to rip or punch the wall or throw something, or you want to cry out, you have to try to remind yourself that it's a process and you're having to go through this. And the best way for you to approach this is to try to see the light at the end. If you can see and you can put in your mind that you can get through this, it'll help you a lot, because you have you're reinforcing yourself positively about an outcome that you want to achieve. And that's going to make you push forward more. But if you're constantly giving yourself negative feedback and negative emotions, you're just going to crumble even more. And this is something, like I said, as a coach, I tell my kids and stuff in tournaments and stuff, because every sport, I mean, if you're a sport athlete listener out there, you've all gone through this. You deal with a lot of scrutiny and a lot of things that happen mentally in sports. Things, you might get injuries, you might get tough times, you might get results not going your way, you might feel like you're a loser, or you're this, or you're not as good, or you're not physically good enough, et cetera, et cetera, et cetera. And you have to try to push through these things. This can apply to everything in life, basically. That's why I feel like sports are so good, because it kind of represents most of the stuff in life. But what I'm saying is, you have to try to see the positive, and to at least build yourself up. And one thing that I think you absolutely should do, and this helped Linda, is start talking to people. I know she's an introvert. She said it. And I think that's one of the reasons it was also hard for her. But if you're able to talk to other people, friends, doctors, hell, maybe even if you have a psychiatrist, maybe you want to talk to a psychologist, whatever it is, talk to your parents, talk to people and break down on them.
Yeah.
Just cry with them. Whatever it is, take it out of your chest. They will help you. They will give you their stories. Maybe your mom tells you, hey, listen, I went through the same shit you're going through when I was your age, when I had my first, or when I had my second, or whatever it is. Maybe you talk to a friend who's already got 3 kids or 2 kids, and she's going to tell you, hey, listen, this happened to me. I know what you're feeling. This sucks. This is a shitty situation. But listen, this is what I did that helped me. Maybe this helps you. And you start getting all these different takes. And trust me, it will help you, because you're going to feel in the same boat. You're going to feel like you're not the only one. All of a sudden, you're like, oh, wait a minute. There's a lot more people that goes through this shit that I thought. And you're like, okay, so if all these people went through this and got away of, and were able to get out of it, or to go past this, then hell, I should be able to do the same. So it motivates you a little bit. It makes you, it's going to make you feel a little more or a little less beat down. So I would suggest people or women out there who's going through this to talk, to just communicate, express your feelings to another person who's gone through the same thing. Or hell, like I said, if you have it could be even your pediatrician, your doctor. I don't know if you have a good relationship with them or whatever. But anywhere you can express this that would give you their take and a feedback, it'll help you a lot.
In my case, was my best friend, Maria Elena. So she was definitely the best help I got. And I think a second thing that helped me a lot, especially with the fact of going back to normal, was working. Going back to my work helped me a lot.
Yeah, because
then I have my life.
You start feeling a little bit of going back to
my life, to what I wanted to do.
To a resemblance of normalcy. You're like, okay,
yeah,
this is starting to feel a little more normal again.
Yeah. It was not everything about the others, which in this case will be the baby. It was like, okay, there's something for me here, which is the work and my friend talking to me and just not taking care of the baby. So those two things were the one that helped me go back to reality, or because I was deep stuck somewhere down there.
And I think also the other thing that helped you was just seeing progressions in the baby as time went on. Like you started seeing, okay, so she's now sleeping 3 hours instead of 2.
Well, she actually slept once she reached 1 month, she slept one day 7 hours. And
I was
horrified. Yeah, I was horrified. I was like, she slept 7 hours. And because I was so tired that I didn't woke up and she didn't woke up. And then the next morning I was horrified. I was like, no.
Yeah, but that wasn't like a common thing where she was doing 7 hours. But she did started doing a little more.
Yeah.
So I think that also helps, just seeing a little bit of progression. You're like, okay, so it's good. Now we're up to 3 or 4 hours. We're not only in 2. Okay. And that's little things that you see, like an improvement somewhere. It motivates you a little bit. Okay, so I'm seeing improvement. So I think as the time went on, like I just mentioned a little while ago, you started feeling a little better every time. Also, you started getting more used to the situation.
Yeah.
I feel like everything you learn as you go through these things, so you were a little more prepared later on. You knew what to do. You knew what each thing the baby did meant. You knew, okay, she wants milk. Oh, she's got a gas. I got to burp her. Oh, she's got a wet diaper, or she about to poop, or she pooped. So you started understanding the needs, so it got easier for you. Because at the beginning, it's not only what you said about the body changes and you don't like how you look, and it's also that you just don't know what the hell's going on.
Yeah.
At the beginning, you're like, okay, so
what should I do?
Yeah, like, so the baby's crying, and sometimes the baby keeps crying and crying and crying, and you're like trying to comfort her, and you're trying to, okay, milk, this, that, and nothing happens, and she just keeps on crying, and you sometimes feel like you want to pull your hair out. And actually, guys, that's why the doctors recommend always have 2 people, especially at the beginning, because sometimes, and I'm not saying this is going to be your case, but sometimes people get so frustrated with the baby because they don't know what to do, that you could actually sometimes harm the baby without you even wanting to, because you let your emotions, you just freak out. So if that's the case, what they usually recommend is you give the baby to your partner and you go take a little break and just calm down. Because if you're by yourself, that's the other issue you have, that if you're having one of those situations where you're freaking out and you're by yourself, then you can't just, hey, take the baby a second. No, it's with you and there's nobody else there.
I do remember that I had to leave at some times and leave the baby a little bit, let the baby cry, get out and breathe a little bit, and then go back. Because he was not the whole time. Sometimes
I was working.
I actually had to leave the baby for a few seconds. Baby's crying, and I'm trying to figure it out, but I haven't found figured it out yet. And I had to leave because I was getting my front load brain was not working. I was like, okay, I need to take a few seconds, recover my mind, and then go back. It just takes time, practice, experience, a lot of patience.
And I think obviously if you had a second baby, you would be a lot more prepared now, at least to deal with those situations because you already went through it once.
I guess. I don't know because don't have a second one, so I cannot tell you.
But I think I'm not saying that, but I think
In
you've already
theory.
went through it once, so you already experienced some of this or this. You can have different situations that occur that didn't happen with the first one. But I think overall, you are a little more prepared than when you were fresh to it.
I don't know about that, honestly, because
Um,
I can imagine. Oh, you have a baby crying, and then you have a toddler here. It's like, how are you going to manage now suddenly too? I'm not sure about
You're
that.
right about that, but one thing that you're forgetting
You're not
is,
prepared for that part.
no, but one thing you're forgetting too is that the toddler now is also in a daycare. So when she's at the daycare, you don't really have the toddler with you. So it's not the same as before. Like having, I understand your point, obviously, that having a newborn, and then you also got to have the other one there too. But I'm saying you also don't have them unless it's the weekend. You're not gonna have them most of the time together, right?
I don't know. Again, I don't have a second child, so I cannot tell you.
Okay. Well, anyway, this is us. Obviously, this is us giving you guys our opinions.
Yeah, for Enrique, everything is very happy, great, fabulous. He just go to work, and then when he comes home, the baby's alive and well cared. Yeah, and then my story is very different because I'm the one taking care of the baby. It's just very different.
I know.
That's why for having a second child is great.
No, I don't actually not.
For
I'm not.
me, it's like
I'm actually
not
not.
sure.
I'm actually not 100% about that either. I wouldn't mind, or I would want to have a second one, but I'm not 100% sure about it either, because there's other factors, not just that I have to, or we have to be really certain about before we have a second one.
Financial, especially.
Well, that's one of them, but I'm just saying in general, there's other. It's not like it's a sure fact, 100% stamp. There's other factors. But what I was telling you is that I do think that going through things once, regardless of there's other situations that occur, but I'm talking about the infant baby. I'm not telling you about if you have a second one and the other one is presenting a different challenge. I'm talking about the situation with the same situation that occurred with the infant. If you went through it once, that same situation, you will feel a little more, I feel like you would feel a little more prepared to do it. We're just putting everything in a vacuum in that section. I'm not adding, not yet. I'm not telling you what other extra things could occur with the toddler and with having extra things here or there. I'm talking about just in vacuum that the same situation with the baby. Like if you would swap them. I think you would. I'm not telling you. I'm just thinking you would be a little more prepared. I'm not saying
Probably.
completely, but you will be a little more prepared because you went through it once.
Probably, yeah. At least I will not be at home when the baby comes from the hospital. Like, what should I do with it?
Well, that's
How
what I'm
do I
saying.
hold?
You will have preparation and things.
I'll be like, okay,
And
I
if he
know
cries,
the baby's crying, probably is hungry.
Exactly,
Let me
the
change the
baby's
diaper
crying.
first.
You already know. Okay, it could be one of these things. Let's try this. Okay, it's not that. Let's try this. And you'll have to learn the new cues for the new baby. But it's not like you're gonna be like, okay, shit, what's going on? You'll be a little more prepared now because you went through it. And hell, if you have, like, one of my clients have 5 kids, when you're in the 5th kid, you're probably an autopilot at that point. I mean, like I would imagine.
I don't know how they do it.
What I'm just saying, when you're in your 5th, because listen,
Gurus.
I see some ladies out there, and we'll probably have listeners who have more than 3 or 4 kids. I see some women out there who go to the Walmart or these places, and they got a kid in the stroller who's a newborn. They got a one tugging in there by the leg. They had another one in the car of the car they're pushing where all the food is in or whatever. So they have like 3 kids and they're alone. And I don't even know. They're like multitasking everything. So what I'm saying is that these people look like they're pros. Like, like new parents are like freaking out with the first one. Oh shit, she's crying. Oh fuck this. Oh my god, there has a little red mark here. What does that mean?
I remember that.
This and
We were
that. Let
so
me Google
obsessed.
this thing. Let's call the doctor. I don't know what's going on. And these ladies have like I said, a kid newborn there, and they got another kid throwing shit around. They got another one in the cart pushing, and they're like talking on the phone in the meantime as they're doing all this shit. And I'm like, what the hell's going on? Like, I mean, like they don't give a shit about anything. It looks like they're in, like I said, like they're in autopilot. They're just, and everything just works. So what I'm saying is they're so used to it that I don't think for them. That's what I'm thinking. I feel like it's always the first one because you're completely fresh to it. You don't know shit.
I also think that it depends on the personality of the parent. Because I am very organized. I am very structured. So if something goes out of the way, it just makes me stressful.
Yeah, but you would be able to structure around it. What I'm saying is you would be able to prepare and structure around it.
Yeah. But
use your methodology and you would be able to kind of maneuver
now
yourself.
I can do that. Now I have like everything quite organized, I will say. And I know the baby is getting a proper education and she's just well. But at the very beginning, I didn't know. So I was just
Yeah, but what I'm saying is that if you
lost.
had a second one, you would be able to structure yourself in a way where you can handle both.
Eventually.
That's what I'm saying.
Eventually.
That you would find a way, whether they're more unorganized or not. Ladies that have a bunch of, or women that have 3-4 kids, by the time they have their last kid, they're basically masters at this stuff. Like they can do all these things at once. And it looks like from the outside, like
Easy peasy.
exactly like you're like, we'd be freaking out. You're like, holy shit. And you see them like it's nothing. Like they're grabbing ice cream there, ice creams while they're talking on the phone, while they're pushing the cart, while the other baby's throwing shit over there, and they're like, hey, Hannah, come over here. We're moving. And then they're chill.
And it
you're like,
almost
why?
feels like they are
You're like, why are they so chill? I mean, I'll be like
freaking out.
about to have a spasm over there in aisle number 5. They're gonna have to call the manager. Hey, clean up in aisle 5. This dude just what you know what I'm saying? Like that's how I would feel. And these guys are like easy peasy, no issue. But I'm pretty sure if you ask those ladies who have the 4 kids and they're acting that way when they're their first kid, they probably weren't like that. That's what I'm saying.
Mm-hmm.
They would probably be all like, oh, what's going on? Oh, call the doctor. Hey, Johnny, call the doctor over there. Something's going on with the kid. Because again, you just don't feel comfortable. That's why there's those funny memes you see on Facebook where first kid,
Then
you're like
second
really
kid.
careful with the kid. Second kid, the kid's full of dirt. Third kid, he's in the mud. And then fourth kid, he's in the
Dancing
mud
with the
and you're throwing extra mud on top of it. That's I'm just saying like that's what at the beginning you're like, oh, he's got to be so clean. The second one, gives a shit. Third one is like, hey, I don't even know where the hell he is. He's probably going around somewhere. Like they don't. When you're in the third, fourth, it's like, it's whatever. I don't care. That's how it looks like. That's why there's memes about it.
Yeah.
Because in reality, you are a lot more laid back about it. You're like,
I'm sure that there are all different kind of parents.
well, but the reason they make a meme is because the over majority does what the meme says. That's why they make a meme. When they make memes is because the majority
high
of people,
percentage.
that's what happens. That's why they make the meme, because if not, they wouldn't make it. But yeah, basically, that's what we were trying to talk about today with the subjects. I don't think there's, right? I think that covers about everything.
Yeah.
Again, birth story, and then postpartum depression. It's a little recap in specifically in the postpartum stuff because I feel like the birth story, everybody's gonna have their own different birth story, their own different things that happen. But on the postpartum, remember, word of advice is when you're feeling down, when you're feeling bad, when you feel like everything's about to the walls are closing in and you feel like there's no escape. And again, this is if you go through it. Some women don't go through postpartum. Actually, there's a study that says 6.5 to 20% out of all women who give birth go through some type of postpartum depression. So that means that there's still around 80% or more of women who don't have postpartum depression. So you might be one of the majority who don't have it, but if you're one of the percentage that do have it, you remember there's a light at the end. Make sure that you talk and you communicate with people. Make sure that you try to get into doing stuff that you remember that you did before so that you start feeling a little more normalcy in your life. If you have a hobby, even if it's hard, whatever it is, try to do something in the limited time that you have that you would feel a little more normalcy. Talk to people. Find a way that you would be able to concentrate on a positive things that will be happening or things that you like and not just only the negative. There's ways to find solutions out of it. You have to keep a positive attitude and just know that there's hurdles that will happen, and we just have to find a way to maneuver and go around them and just do the best we can. And whatever choice you make, just always make sure whatever people say out there that you feel is negative feedback, remember, you're the person going through this thing. You're the person who's raising the kid. You doing it your best way you can.
That's all
Whatever
that matters.
people say out there that they did with theirs, unless they're giving you a positive feedback, unless they're telling you, hey, you're doing an awesome job, I would recommend, if you feel this way, this is what I did. Maybe it works for you. Again, do whatever you feel works for you. But this is, if they're giving you advice on what worked for them so you can try it, that's fine, right? There's no problem. You can try it and, hey, maybe it does work for me and maybe it does help me.
Yeah.
But if people are just saying, hey, you're doing this shit wrong, this is not the way you're supposed to do it, this is going to be bad for your kid, you should be doing it this way.
Yeah.
That's when it's incorrect. That's when you should tell them, hey, listen, I'm doing it the best way I can. This is the way I feel it's working for me at the moment. If you don't like this way, well, listen, I'm glad it worked for your kid this way. But for mine, it does. What I'm saying is, whatever your decision is, that's the correct decision.
Yes.
It's not the decision that anybody else tells you to do.
Yeah.
And as long as you keep that in your mind and you remind yourself that every day, you'll feel a little bit better about yourself. Because a lot of times what really gets to you is negative feedback that other people are giving you because you're going through a bunch of shit and when somebody tells you some stuff that you're doing wrong, it's like stepping on shit. Like you were there and then you stepped on it and then they just throw more shit at you. And you feel like you're covered in shit. So just remember, what you do is right, and don't let anybody else tell you that it's wrong, okay? Because you're the person raising the kid. You're the one doing everything, okay? Now, apart from that, I think we can kind of close it out for today, right?
Yeah.
So let's just tell the public here or the people, the listeners, what will be happening on part 3, right? So what was it again that part 3 was about, Linda?
How to deal with when you're traveling.
All right. So this is more because situations that have occurred with us because we've done flights and we've done cruises with Victoria. So it's basically, this might be I don't think this is going to be as long as these last 2. So part 3 might be a shorter kind of like conclusion to this whole parenting thing. But again, it's going to be like Linda said about traveling. So, things you might want to know when you travel with an infant or with a toddler. Things you might want to pack.
Yes, a little packing.
Things you might want to ask your pediatrician prior to. all these little nuances that you as a firstborn parent, again, we're talking about
Tips and
firstborn parents
tricks.
here. If you've already gone through this, maybe you just hear a different side or a different take of what happened with you. But we're talking about the experience of a first parent, right? Not as a parent of 5 or a parent of 4. This is the parent of a firstborn. Okay, so things that basically about traveling, about going out of the house with the baby. And again, I want to thank you all for listening today. I think for Linda, this was really good to get it out of your chest, right?
Oh yeah, for sure.
So yeah, Linda's been wanting to do this one for a while because she feels like this is one of the things that was eating her alive back
I
in the day.
think the biggest problem that I was having is that a lot of people don't talk about it, and it's just like a taboo. You cannot mention to anybody that you have postpartum depression. I'm like, no, that's not right. I actually have to talk about it, and I have to let know other people, yeah, this might happen and this is completely normal. It's okay. And you will get there. You will find light at the end of the tunnel. Believe it, even if you don't see it, because believe me, I didn't see it, but it will get better. And just try to stay as calm as possible. And I know the road is dark and it's long, but and it feels depressed, but there is light at the end of the tunnel. And that was the biggest takeoff that I wanted to let you guys know, was like, this might happen, and there are decent percentages that, yeah, there's a good amount of percentage of females, and I'm not even sure if that's accurate, but there is a good amount of females that go.
Yeah, it's around 6.5 to 20% based on that thing is that biometric
But
institute.
20% is a big amount of females
Yeah, on the higher
on
end.
the higher end.
But yeah, I mean it's a pretty good amount.
Yeah,
It's a basically 1/5.
1 in 5. Yeah.
1/5. Yeah, yeah,
Yeah.
yeah. Anyway, again, let's just wrap it up for this. It's been another long one. We've had the last 2 have been pretty long, but hopefully it was, like I said, hopefully it didn't bore you. I think we're giving you good information, and I think there's different perspectives. Everybody has a different one, so that's why I feel it's so interesting to just listen to different takes on how people approach these parenting situations. You can follow us on YouTube. You can follow us wherever you listen to your podcast. Again, as well, follow us on Instagram at Honey Let's Do a Podcast. There you can also message us. You can give us information about about what you thought about this episode, or things that you went through. Maybe you had postpartum depression and you want to tell Linda about it. Any of those things you can tell us there. Let's just end this thing now. Have a blessed day. We'll see you next Wednesday. Peace out.